My name is Chris Hourigan. I run the Laboratory of Myeloid Malignancies at the National Heart, Lung and Blood Institute at the National Institutes of Health in Bethesda, Maryland. So I was the faculty discussant of the Leukemia, MDS and Allotransplant poster session at the ASCO 2021 meeting. And I'm here to discuss today what advances have there been for biomarkers in AML. So I reviewed at the meeting 3 abstracts that I think illustrate broad themes in biomarkers research in AML. Firstly, this idea that's very close to my heart that we don't need to fly blind. We can have higher sensitivity response assessments using measurable residual disease, and this can improve prognostication for those who achieve a remission. Keith Patz from UPenn presented on behalf of his multi-institutional collaborators in poster 195840, evidence from the Valley randomized phase 3 study, that MRD testing can improve risk stratification, not just for those treated with intensive chemotherapy, but also for those treated with the now more commonly used venetoclax combination. Secondly, the second theme I identified was this idea that we can move beyond this narrow conception of a simple one drug, one target, or one target, one drug in precision medicine. And I call this mechanistic hubris. And really the opportunity here is for us to get to a more integrated and predictive approach. I think this was exemplified by poster 195821 from Barts in London, who explored proteomic signatures to better identify patients likely to respond to midostaurin and chemotherapy, including, interestingly, potentially those who are FLT3 wild type. The last theme identified is really overcoming our cancer clone-centric chauvinism, and was shown by poster 195818 from OHSU, which goes beyond leukemia biology into the host microenvironmental changes that may contribute to resistance to targeted therapy, in this case to a different FLT3 inhibitor, gilteritinib. So in summary, the biomarkers in AML have this potential to give us a better understanding of future relapse risk, help us pick the right drug based on a more sophisticated understanding of leukemia biology than just a single mutation. And finally begin to understand it isn't all just about the leukemia, that host biology is also an important modifier. Now, the challenge is going to be how to move in a rigorous, validated, and coordinated fashion from potential biomarkers being good for posters, presentations, publications, into something that's good for patients. And that's the work we have to come. Thank you very much.